Well, we're only a few days now into 2016, and for a lot of people, a new year means a fresh new start. From gyms to grocery stores, a lot of us are trying to make some changes. But what will be the big trends this year in the plastic surgery world? Dr. Michael Kim is joining us live in the Wink studio to take a look at which cosmetic procedures are lifting and which ones are sagging, right?
Yes.
Good morning, Dr. Kim.
Good morning.
So what are we going to see this year? I know last year a lot of people were doing the fillers and that kind of thing. Is that going to continue?
Yes, there's a chart I think I put up, but in 2016 we saw in 15 and 14 increased number of younger patients.
Oh, okay.
So we're seeing patients in their 20s and 30s getting fillers and Botox. And minimally invasive procedures such as Botox fillers, fat reduction procedures. We're seeing a huge trend in people trying to do procedures without having downtime of surgery. So I think we're going to continue to see that trend in 2016.
More men apparently jumping on the plastic surgery bandwagon, right?
Yes, that's been a current trend in the last 5 to 10 years. More men is less of a stigma. It used to be, oh, men don't get plastic surgery, but now we see a lot more men coming in for consultations, tummy tucks, facelifts, fillers.
Much more common
Much
then.
more common, yes. And the fillers, of course, we talked about increasing. And the amount of plastic surgery done is increasing. I think we had a economic turmoil about 8 years ago, 10 years ago, and people are now catching up with that and having more money, so we're seeing a lot more disposable income, and patients spending a lot more money on plastic surgery.
So when you say that they're doing multiple procedures at one time or in 1 year or something like that?
Yes, yes, and I think if we go to the next slide, you can see the last bunch of trends that's going on, but very exciting, the social media, you know, Facebook, Skype, people are using that all the time. They can see themselves in the pictures, and if you've ever seen yourself in the picture of Skype, it looks terrible.
You never look good at that, that's right.
So I think that's drawing some people that have more plastic surgery. We're seeing a lot more trends again in the non-surgical fat removal. And of course, people heard of freezing fat machines. There's a new drug called Hybella by Allergan that makes Botox. And it's just FDA approved last year, and it basically injects into the neck. And it's a combination of a drug, deoxycholic acid, which is in the old lipodissolve, but it really works. You can see the results on the bottom right in the chin area, and that's going to be a big trend this year, I think.
And again, non-surgical, so
correct.
This is something you could do as an outpatient.
Correct. And then on the bottom left, you can see a new machine, just FDA approved a couple months ago. It's called Sculpture, which is similar to CoolSculpt, and that instead of freezing the fat, it melts the fat. But the advantage of this machine is that it's going to have 4 heads, not 1. And instead of an hour, it's going to take only 30 minutes per treatment. So similar results, probably somewhere between 20 and 25%. You have to remember that these procedures are meant for patients with very little fat, patients working out with small areas of fat.
I see.
Love handles, abdomen, not for patients who are overweight.
I see. It's still traditional, then surgeries would be required for them, I would think.
But it's being done a lot, and a lot of happy patients. I think the last thing I've seen is 80% of patients are very happy with that procedure.
All right, Dr. Kim, thank you so much. We appreciate it. More information on our website, winknews.com.